Hello, good morning, everybody. So today, we have a very interesting case. Also, we already do live transmission just to show about the new technology of that we have in our institution. That is Bravo capsule for GERD. But today we have, in addition, a very nice case. This is a ¿Cuántos años tiene el paciente? 74. This is a 74 years old male with a history of jaundice, of recently apparition. I don't know how to say. Recently, that started recently in few weeks ago, and with a history also of suspect of liver cirrhosis. Okay, the situation is that this patient have jaundice from a few weeks ago, and we start our evaluation today with US because we needed to know some situations that were not clear in the history. There is an abdominal ultrasound that say no, MRI that say that this patient have dilation of the biliary tract, but clinically this patient have a lot of clinical data at the physical examination of liver cirrhosis. So for us, this patient have a liver cirrhosis, and we don't know the origin of this liver cirrhosis because this patient didn't have any history of alcohol intake or pills or drugs or anything. There are not the virus, and now this patient have a platelet level of less than 150,000. So now, if I remember very well, this patient have now 115,000. So it's clear that this patient have liver cirrhosis due to the clinical aspects, the history of this patient, and also the physical examination. There is a lot of clinical data of that. So during the radial US, I am now using a linear US. We also saw a lot of collateral vascularity. So confirming that the presence of a portal hypertension also, and I need to start this evaluation, not just focus my evaluation just on the, on the suspicion of liver cirrhosis that we don't know the origin. So we need to know what happened here, and also because of the recently history of jaundice a few weeks ago with a dilation of the biliary tract of the, to be exactly, no, from the left lobe, because if you see the left lobe of this patient, there is not any kind of dilation. You see that it's clear that you see the shape of the liver is very regular. Here, for example, you see the liver. I can show you that is very irregular, and a lot of irregularity in the shape of the liver, and there is a lot of data also showing that this patient have a liver cirrhosis. And I will start my approach, not just doing now liver biopsy, because we need it. We need more information about this liver cirrhosis that have this patient. We need to know the origin of this liver cirrhosis. We were discussing, we don't know, and probably one of the possibilities that we have in Latin America is secondary to NASH, non-alcoholic steatohepatitis. Okay, but the situation is also that there is in the right lobe there are some areas of here, you see, there are some dilation of the biliary tract. So we need to evaluate this area because this is not normal, and this patient have also a recent history of weight loss, and one of the possibilities is to have also lesion in the biliary tract. So my next step after my liver biopsy is to perform spyglass cholangioscopy, because this patient needs to be evaluated in both ways. So we discuss a lot with our team here, and this is the approach that we will do. So now I will use fine needle biopsy using new needle. This needle is already available worldwide, I believe, and is a 19-gauge needle. This is the acquired needle. I will show you a little bit. This product is very interesting. The shape of the distal part of the needle is totally different. So it's a trident, and you can have more tissue. So I will use this needle to do an evaluation of this liver cirrhosis, and if the pathologist can give us a little bit more of data. I don't see any mass here. I just see a dilation of the right lobe and these irregularities in the liver. So I will try to use not a lot of pressure. You see, I diminish because sometimes we pass the portal vein and we can have a lot of blood. So this will avoid the blood. So I am here now. This is my needle. You see here? Okay. So very hard liver. I will do my aspiration here. It's not a big aspiration, exactly to avoid blood coming inside. I will do some passes inside. It's very hard, the tissue. So I am showing how it needs to be do this technique. So one of the best paper that I read was published in Gastrointestinal Endoscopy for liver biopsy guided by US. So we need to provide that we are here using and doing a US before ERCP, and to have more complementary data regarding this patient. So one is this was published by Dr. Nieto et al. And the reports until now show that the US liver biopsy have more data than the percutaneous liver biopsy. That's the first advantage. The second advantage is that we can perform a biopsy from both lobes, from the liver, and the percutaneous liver biopsy could not have this advantage. Well, is the disadvantage of this of the percutaneous technique. So I am doing my biopsy. You see my needle going inside and outside, and we will see if we have any tissue. So I am doing this in my left lobe first, and then I will advance my scope, and I will be positioned in the antrum to have access to the right lobe. That's the way to use the liver biopsy technique. So we can have more data from both sides, and we need to remember now that this patient also have dilation of the right part of the biliary tract. So what do we have now? I think we have a very nice tissue. I will show you. Prende la luz, por favor. ¿Me puedes mostrar la cámara, Bolaños? So you can see here you see the quantity of tissue is a lot, and there is not blood. So we have a lot of tissue, more portal spaces will be regarding with this biopsy. So this is a very nice needle and technique. Again, I will try to show you. You see the quantity of material? It's incredible. You see? Very nice. So now, this is formalin, okay? So now I will advance my scope, and I will do a liver biopsy from the right lobe. So now you can see here the gallbladder. We need to avoid to pass through the gallbladder. So now I am in the right lobe. Sometimes you can do it transbulbar. I am transbulbar now. I think I am in a very good position here. Let me see if from the antrum I can have better position. So I am looking for my liver now. I have my right lobe here. Just to have to pay attention, do not cross the gallbladder and do not cross the portal vein or other vessels. So I think I am in a very good position now. So here you see the right lobe, and my idea is to have tissue from this area. Again, not a lot of aspiration is very important. You can avoid the blood coming inside the needle. You see there's a sludge also inside the gallbladder. is the kidney, and this is my right lobe. Perfect. Now I am perfect. You see? So my needle is here, my right lobe is there. Perfect. I do my aspiration. I see my needle very well. There's some blood coming, but this is from the portal vein probably. Small vessel that I take it. It's not a problem. I will stop here. There are tissue inside. And now I finish here, and I will do my ERCP now, and I will pass my spyglass. There are no lymph nodes, so I don't need to perform any other biopsy. Aquí muestra. Cuidado. Perdón. Allá se te está saliendo, no muestro. No, acá. Gracias, sigue. Muy buena muestra. Sigue. Sigue. Guarda. Me das el duodeno, por favor. This is from the left side, from the right. Puedes poner la imagen grande. You see? Not blood. There was a small amount of blood from the beginning, but you see the quantity of material that we have. So this is a very good biopsy. There will be a lot of material for evaluation, for the pathologist evaluation, and I have a lot of tissue from both sides. So I will prepare my duodenoscope now. We will prepare the spyglass also, because I need to evaluate inside what happened in the right biliary tract. Hell. Digo, Gaza. So now we will perform ERCP. I am at the level of the papilla. This papilla is very, very small papilla and flat papilla. So we will perform biliary access. Hay que centrar bien eso. I need to be positioned in the long position because the papilla is a little bit large. Oh, maybe there. I will try. So for this small papilla, one of the tip also is to use the guide wire, the tip of the guide wire, just to go inside. You see? I like to perform an injection first. You see, this is the pancreatic duct. So I will let my guide wire here. I will ask for a second one. Guide wire. Dame otra guía. Empuja. This technique is called the double guide wire technique. So when you are inside of the biliary tract, when you perform cannulation of one of the duct, let the guide wire in place and go and take another one just to go faster. Then if you want, you can put a small plastic stent just to avoid acute pancreatitis. Segunda guía. Ok, necesito la punta de la guía. I am again in the pancreatic duct, so I will retire a little bit more. I will retire also my guide wire. I'm trying to change my angulation. Now we are perfect. You see? The ERCP, ponme la rayos X, por favor. So, the double guide wire technique help you just to identify very well the duct. Quiero ver arriba. That what do you see is blood, and you see here the right biliary tract is dilated. Okay, in the middle, in the common biliary duct is blood, but the right biliary duct is dilated. Necesito más contraste, por favor. So I'm injecting a little bit more of contrast. I need to see there is something in the right biliary duct. You see? Ok, empuja la guía. Vamos a cortar. Quiero un stem plástico de 5 French para dejar en el páncreas. So what I will do now is to perform a cut here. I will cut. ¿Podemos mostrar la imagen endoscópica, por favor? Okay, you see, there is the bile is a little bit black, so it's retained. It means that there was a lot of days, you know, something blocking. I will pass. This blood is from my fine needle biopsy, so don't worry about that. Let's go to see what happened here. I don't know what is happened, why this patient have this dilation of the right biliary tract. Quiero un balón. Sí, necesito que me prepares esa. So I will pass a balloon first, just to clean my biliary tract. Toma. Sí. Ten. Well. Ten. Okay. Inyecta contraste. Okay, infla el balón. Okay, listo. Empujo. So I am cleaning now using a balloon. Ok, desinfla. Ok, listo. Dame el stand para dejarlo puesto en el... Sí, desinfla. Desinfla. Ok, empujo. Un momento. Ok, estoy aquí. Puedes lavar con agua, por favor. A través del balón. Sigue. Ok, listo. Empuja. Ah. No, por aquí no, por acá, por acá. So now I will place a small plastic stand of 5 French by 4 centimeters in my main pancreatic duct just to avoid pancreatitis after my manipulation, and then I will pass my spyglass just to see what happened inside, because I am not understanding why this patient have a segmentary biliary dilation. The MRI didn't show us anything, and that's why this kind of technology like cholangioscopy can help us to do a good diagnosis in these patients. So now I am putting my stent inside the main pancreatic duct. So, ok, puedes liberarlo. Okay. There is. Now I will use an spyglass now. Foto. Podemos ver la imagen del spyglass. ¿Puedo ver la imagen del spyglass, por favor? momentino. Estamos adentro. There is a cloud. Un coágulo. Tengo que salir. Salir empuja. Ok. Ten. Que retire la guía. Sácala, sí. So now, I am in the left biliary tract, intrahepatic biliary tract, you see here. So this is just blood from my biopsy, liver biopsy, okay? But I am trying to go now to my right this is left. So I'm trying to see what is happening in the left, in the right hepatic duct. So I don't know if I am very good. No, this is the middle. This is the middle. This is not good. And you can see I need fluoroscopy to have a direction to try to reach the right biliary tract. Here. Maybe here. Or maybe this is the cystic duct. I believe this is the cystic duct. This is the cystic duct. So now I need to go a little bit more high. Okay, so now I am in the area that normally I need to reach, where I can reach pasemos contraste por favor. So I will use contrast now just to follow. Okay, pasa. Okay, here is. So I use contrast just to see where is my enter. It's not so easy, huh? I cannot identify the maybe here. Contraste. Un momento. No. It's down. It's just here. Okay. Necesito una guía. Sí, púrgalo. Guía. I will try to use my guide wire to see if I can see the enter of the right intrahepatic biliary tract, because I'm not so sure where is the. No, retira, empuja. No, 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 dame acá. ¿Cómo? Very difficult. It's just a little bit more to my right. Empuja ahí. Empuja ahí. No, retira. Empuja ahí. Empuja. Un momento. No. I don't see my Empuja ahí. No, retira, retira. I don't see my enter here, huh? I don't know where is. No. And down. It needs to be here. Normally should be here. But I see just 2 enters. I don't see my other enter here. No. Empuja ahí. No. Retira. Empuja ahí. No. Retira. Empuja ahí. Okay. I will do more contrast. Más contraste. Sí. Puedes pasarlo por acá. Por este. Más contraste. Puedo ver las primeras imágenes. Sí. No. La anterior. Ahí. Okay. Okay. I cannot reach my right intrahepatic. Agua. I cannot reach. I see my 2 ears, my 2 branch. Empuja. Empuja. No. Empuja. Sí. No, retira. I cannot reach my right intrahepatic duct. I didn't see it. Jorge, what do you think? Excuse me? Probably. I will try to clean. Dame un balón. I will try to clean my biliary tract to see if I can reach. Dame. Balón con guía. Down a little bit my air. Prepárame el esfínterótomo primero. No, ahí entramos, ahí entramos. No, estoy en el páncreas. Prepárame el esfínterótomo. Empuja la guía. No. Dame el esfínterótomo. Noticia. Tenemos dos guías. ¿Por qué no la tienes cargada la otra guía? I will try to clean the biliary tract. But I believe that this is not the problem. There is any kind of stenosis. Empuja. Ok, empuja. Empuja, empuja, empuja. Balón. Empuja. Empuja más. So now I will take the balloon. I will try to clean a little bit more. to try to see better. Porra. Purga el catéter, ¿no? Porque está duro. So I will pass a balloon now to try to take off all the clothes inside. Jala. También. Momento. Ten. Ok, infla el balón. Sí. Quiero ver arriba. Inyecta. Oh, it's there. You see? It's up. Ok. Foto. Cierra. Sí. Desinfla. I will try to claim 10. Sí. So I think I need to go right. I think. Ok, 10. Infla el balón ahí. Empuja. Gasa. Ok, desinfla. Oh, la guía. Momento. No. Momento. La perdiste. Se salió la guía. Tienes que empujar, Clever. No creo. Retira. Retira. Ok, perfecto. Retira la guía, por favor. Prepárame el esfínteroto nuevo. Quiero ver abajo. Oh my god. Ok. No, y sí. Esfínteroto con guía. Empuja la guía. Empújala. Okay, voy a intentar ponerme en la vía derecha. I will try to put my guide wire in the right. Very try. No. No. Ok, empuja la guía. I will continue to clean. Dame el balón de nuevo. There is something there. There probably is a stone, intrahepatic stone, huh? But we need to see if there is not any mass, and that is the big problem because the weight loss of this patient is the situation. So we don't have any data, any other data, and we need to evaluate this. Jala. Ten. Ok, necesito que pases agua. Sí. So I will clean with saline solution inside. 10. 10. 10. 10. Ok, salina. Sigue. Sigue. Sigue lavando. Sigue lavando. Ok, infla el balón. No tanto, ¿sí? La mitad, dijo. La mitad de lo que... Ok, listo. Empuja. Empuja bien. No está inflado. Listo, gracias. 10. 10. Ok, inyecta contraste. So I am injecting contrast now. I will clean my last time. Ok, infla el balón, no tanto. Ahí está bien. Empuja. So it's very important that your assistant push the guide wire to avoid to lose. Ok, perfecto. Ahora lava aquí afuera. Lava con salina. So I will clean just with saline solution outside. Perfecto. Very good. So 10. Sigue. I'm going inside again. 10. 10. 10. 10. 10 más. 10 más. Ok, lava con salina. So I am washing with saline solution the biliary tract. Contraste, por favor. Ok. Infla el balón, igual que en antes. Ok. Foto. Empuja más. Desinfla. Ok, listo. Dame spyglass. So I will pass my spyglass. No. I hope to see anything, but I believe it's the right intrahepatic bile duct is a little bit up. It starts in the middle of the intrahepatic duct. It's not starting from the main biliary duct. Toma. Se salió la guía. Se salió la guía. Dame de nuevo finterótomo con guía. So what should be the approach now? I will try to see with my spyglass. I think could be a little bit difficult, but I need to reach the right hepatic bile duct because empújala guía. Empújala. Because if I not reach, I cannot see what is happening inside. So if I cannot reach with the spyglass, I need to at least to reach with my guide wire and go inside, okay, and at least to do a brush or to put a plastic stand just 2 months to evaluate better this patient. Okay, I will try again. ¿Podemos poner la imagen del spyglass, por favor? Ten. Momento. Ahí entramos. Okay, now it's more clear. Retira la guía. Retira todo así. So I am in the right hepatic duct, and I believe probably is here. The problem of this patient is here, probably. There is a lesion here. Oh my god. There is a lesion. There is a tumor. You see here? So there is not the problem is not a stone. It's a mass here. You see? So I will use now my spy bite. And this is the reason of the dilation of this right hepatic area. I'll try to pass here. Okay, dame pinza de biopsia. So I will do I will perform a biopsy. I don't understand very well this lesion. There is no neovascularization. So what I will do is to do a biopsy here. Empuja. Okay, abre. I am using my biopsy forceps now. Abre. Está abierto. Cierra. Jala. Listo. Ok, pasa. Empuja. Empuja ahí. ¿Pasó o no pasó? Empuja. The angulation is very important to pass the biopsy forceps. Yeah? Ok. Necesito que abras. Open, abre. Ok, perfecto. Cierra. Retira. Ok. Ahora necesito una guía. Sí. Primero contraste. ¿Puedes pasar contraste? Llega. Empuja el contraste. Ajá. Quedo arriba. So you see, we are there. So this is the problem. There is a mass here. Foto. Ok, pasa la guía. Incredible. Okay, gracias. But I don't know if this is a cholangiocarcinoma. It looks like. Here I see some neovascularity in this area, in this part. We need to see what happened. I will put a plastic stent just now because I need to drain this area. Perfecto. Empuja. Perfecto. You see? We were exactly, and we pass. Empuja. That's why I didn't understand where was my right area. Empuja. Empuja más. No, no, espera, un momento. Un momento, te ayudo. Un momento. Empuja. Un momento. Sigue. So I will try. Cuidado. No empuje más. So I will try to pass pigtail. Okay. It's very difficult the position, huh? We have the chance that this is a mass, polypoid mass. Okay, empuja. Empuja un poquito más. Retira un poco. Tú retiras un poquito. Ahí, ¿eh? Un momento. Ok. Trata de empujar ahí. Empuja, empuja. 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 It's not so easy because the angulation and the tumor. Empuja. Empuja, empuja más. Okay, I will try to pass a stand, but a plastic stand. I need pigtail. Siete French por 10 centímetros. Okay. Why 7 French? Because I don't have. If I put another one, a big one, I will not have very good chance. I need to confirm that this is a cholangiocarcinoma, even if no. 7 French por 10 centímetros. Eso tiene 10 French por 10 centímetros. Ah, ok, ok, está bien. Empuja, empuja. Empuja. So what is the situation with this patient? If this patient confirmed that this is a cholangiocarcinoma, there is no chance for resection because probably it's very difficult. This patient have liver cirrhosis, so we need to discuss with surgical team, and probably he will need he will need metallic stent just for treatment, you know. No chance in my country to liver transplantation, so I will put first a plastic stent, and the metallic stent we will change once we decide what kind of lesion this patient have, and we decide with surgical team if there is any chance for treatment for surgical resection. A little bit difficult this case. I'm sorry if I take a little bit more of time, but this is a live transmission. There's no decision here. Even if I am not faster, we solve this case. This case, we know it now that there is not a stone, there is a mass inside, and we are trying to do the correct for this patient, the best one. So now I will use pigtail because I think it's easier to pass, and we'll stay inside and we'll drain this right intrahepatic bile duct. In addition, it's a 7 French, and so it's easier to pass the angulation. If I use 8.5 or more, will be difficult. Other advantage to use this type of stent is that if we don't have good cells, good biopsies with my spyglass, I will have I can retire the stent and I can send to evaluation for histopathology. 70% of patients could have cells inside the stent, and with that we can have a result of histopathology. So we are almost finished in few minutes. The pigtail also will have the advantage to avoid immigration. There are a lot of advantages to use this stent in this case. I think it's the best indication. Imagen endoscópica, por favor. Momento. So I am pushing my pigtail now, and you see I think it's the maneuverability here is a little bit easier. Then otra casa. You see the angulation, huh? It's very difficult, huh? We are almost there. Maybe if I put myself in the long position, I can have more power to push my stand. Let me see. Problem continues to be the angulation, huh? Very difficult. Maybe. The angulation is terrible, huh? Sí, empuja la guía. Ok, dame un segundo. I need to pass a little bit more, huh? Empuja la guía. Ahora sí, 10. 10. Just a little bit more, huh? 10. Very difficult, huh? Empuja la guía. Okay, 10. The angulation is the big problem here. Very big problem. Just 1 centimeter more. 1 centimeter more. Meten ahí. Ten. Sí, empújalo, por favor. 1 centimeter more. If not, I will not have a good drainage. Almost there. I think we are reaching now. Empuja. Almost there, huh? To be more sure, just 1 millimeter more. Gasa. Oh. I am there, huh? Yeah. Hola, yeah. I think we are there. We crossed. Yeah, but it's not perfect to me. Okay, I will less here. I think we are good. I will not try to push a little bit more. I think we are very good. We are not perfect, but we passed the mast. I cannot pass a little bit more. I think this will help, but okay, okay, retira la guía. Okay, sácala. Perfecto. I think it's okay. This will help. This will drain. Puedes cambiar la succión porque no tengo más. No aspira. Necesito aspirar. I'm good. Yeah. So I am trying to see if we have a good aspiration and try to see if the. Okay, now. Okay. So what I think is draining well now. Is a 7 French, so it will drain this area. I am in a good position. Okay. But we need to be very clear with this patient. In less than 15 days, we need to retake this patient, this case. And probably I will retake with my radiologist, okay? Why? Because I need that my radiologist go inside the intrahepatic right bile duct and to pass to me a guide wire, because I will have more better position, strong position with my guide wire to put probably a metallic stent if this patient have a malignant lesion, a cholangiocarcinoma. Okay, so we finish the transmission. Thank you, and I'm sorry for taking a lot of time with this case. It was a very interesting case.